This video outlines the steps involved in performing an active voiding trial. First, ensure that urine output has been adequate while the Foley catheter has been in place. If urine output is less than 30 milliliters per hour, contact the on-call urogynecology team. If urine output has been greater than 30 milliliters per hour, it is okay to remove the catheter. If vaginal packing is in place, remove it and document its removal in Cerner. To begin the trial, gather your supplies. For this trial, you will need a 50 milliliter Toomey syringe, 300 milliliters of sterile water or saline, a toilet hat, and an empty 10 milliliter syringe. Place the toilet hat in the toilet to prepare for patient's void immediately after catheter removal. Now stand the patient to ensure that their bladder has been fully emptied into the catheter collection bag. This also ensures that the patient will be able to stand and perform the voiding trial immediately after catheter removal. Remove the plunger from the Toomey syringe, then disconnect the collection tubing and backfill the bladder with 300 milliliters of sterile water or saline to gravity with the Toomey syringe. If backfilling to gravity stops, then discontinue filling. Do not force backfilling with a plunger, as this can damage the bladder. Remove the catheter with care not to allow urine to leak out of the catheter during removal. Have the patient void immediately in the toilet hat and record the volume under voided urine output in Cerner. Record the backfilled volume in the chart under indwelling catheter urethra in the subcategory irrigation intake. This will usually be 300 milliliters, but may differ if filling stopped spontaneously during backfill, or the patient has a very large bladder capacity, and instructions were provided to backfill a larger volume. If you were able to backfill the 300 milliliters and the volume voided is less than 200 milliliters, then place a new catheter. Inform the fellow, resident, or attending involved in the case if the Foley catheter was replaced. If you were unable to backfill the full 300 milliliters, contact the on-call urogynecology team with the patient's voided volume and backfilled volume for further instructions on catheter replacement. If patient voided over 200 milliliters, then leave the catheter out and have the patient void every 4 hours for the remainder of their admission and record in the chart. Contact on service fellow via diag notes with questions.